A new vaccine advisory committee, appointed by Health and Human Services Secretary Robert F. Kennedy Jr., held a meeting in mid-September 2025. The 12-member panel replaced the previous 17-member ACIP, Advisory Committee on Immunization Practices. The meeting focused on COVID-19 vaccines, the MMRV, measles, mumps, rubella, varicella, combination vaccine, and the hepatitis B vaccine at birth. Key decisions and recommendations. 1. COVID-19 vaccine recommendation shift. The panel did not issue a broad recommendation for COVID-19 vaccination for any group. Vaccination was advised as an individual decision to be made in consultation with a healthcare provider. This marks a shift from prior policy, which had strongly recommended vaccination for seniors and other high-risk groups. 2. MMRV vaccine restriction for young children. The panel voted to restrict the use of the combined MMRV vaccine for children under age 4. They recommended giving the MMR and varicella vaccines separately in this age group. The main concern cited was an increased risk of febrile seizures in young children receiving the combination vaccine for their first dose. Some experts questioned whether new evidence justified this change. 3. Hepatitis B vaccine at birth. Vote deferred. The committee discussed whether the birth dose of hepatitis B is necessary for babies born to mothers who test negative for the virus. The vote to revise the current guidance was postponed indefinitely, leaving existing recommendations in place. 4. Procedural and evidence concerns. There were concerns about how evidence was being used, with some decisions appearing to rely on theoretical risks rather than solid new data. Some votes were reportedly confusing or lacked clarity, requiring further clarification. Changes compared to previous practice. The panel emphasizes individual choice over broad public health mandates. Long-standing vaccine policies, even those considered safe and effective, are now being re-examined. The usual framework for evaluating risk and benefit may be applied less consistently, raising questions about scientific rigor. Criticisms and concerns. Scientific rigor. Some decisions may be based on selective evidence or limited studies. Public trust. Revisiting established recommendations without clear new data could erode confidence in vaccines. Risk of undervaccination. Confusing guidance may lead to delayed or skipped vaccinations, especially in children. Panel expertise and process. Some members lack prior vaccine policy experience, and some votes were procedurally unclear. Implications going forward. Recommendations must be approved by the CDC director to become official policy. Insurance coverage and state vaccination programs often follow ACIP guidance, so changes could affect which vaccines are funded or recommended. Fall COVID-19 booster uptake could decline without a broad recommendation. The panel's approach reflects a broader policy shift, more focus on perceived risks, parental choice, and skepticism of one-size-fits-all mandates.